So excited. Thank you for watching. Thank you for listening. I know you have a lot of choices, a lot of great content out there, but you've chosen time with us because we have great guests like Vilas Dhar. Vilas, welcome to Digital Voices.
Thank you so much. I'm really excited for our time together today.
Yeah, it's going to be so good because we're going to talk a lot of different things: philanthropy, AI, healthcare, leadership, because you're the president of Patrick J. McGovern Foundation. So, yeah, let's jump right in. Vilas, tell us a little bit about yourself. Like, where were you born?
Totally. I grew up in the most magical place. I grew up right in the center of the United States, about 2 hours south of Chicago, middle of cornfields and soybeans. My parents came from India, but I was born here in the US. Growing up in Southern Illinois in the 1980s, with all that came with, we were an immigrant family welcomed by an incredible community. And this town I grew up in was one of the national centers for supercomputing. Was a place
Mm.
that was about the future. It was this way that the public invested in shaping what became the future of the internet. So I grew up, running through supercomputer arrays and learning to code when I was very young and writing my first video game. And so I almost saw a little bit of the past, the present, and the future every day of growing up. And it was fantastic. I mean, I started my career thinking about AI 25 years ago. And throughout my career, it was always a part of my life. Technology, of course, how we built the internet, how we built social media, but this promise that always seemed just out of reach. What would happen if we could build these tools that didn't just iterate our ways of being? It wasn't just, we'll go from writing a letter to writing an email, but fundamentally change our capacity as humanity to understand the natural world, to make sense of data, to build tools that reshaped how we communicate with each other. And for 20 of the last 25 years, that always felt just out of reach. I mean, we kind of knew how to get there, but we couldn't quite get there. But starting about a decade ago, I really began to see the contours of how AI would reshape our society. And so began to build the infrastructure that would let us, when technology got to where I knew it would get to, we'd be ready for it.
Yeah.
That's kind of what the journey has been. So, over the last 5 years, and I know we'll talk about this a bit more, I've been building the institution and the set of institutions that I hope will just continue to give us that capacity
Yeah.
to make sense of what AI means for all of us.
I love that. Yeah, that's why so excited for this conversation. Share a little bit about responsibilities as president of global philanthropic organization. I mentioned already the Patrick J. McGovern Foundation. Tell us a little bit about the foundation, and then what are some of the responsibilities? Because I know a lot of our listeners, like myself, I'm super curious.
The name of the organization I lead is the Patrick J. McGovern Foundation, as you said. And the institution I build doesn't look like most foundations. On one side, we believe very deeply in the idea that technology can help us do really great things for humanity. But on the other, the technology by itself is never going to do that. It requires us to come together to shape what that looks like. So what we've done is build an institution that's really tried to support and build the ecosystem of communities that are creating what the future of AI looks like. From policy advisors and organizations that support policymakers at scale to the people who are building real AI tools that support people where they are. From tools that change the way people get access to healthcare or let us make sense of the climate crisis to tools that restructure nonprofit journalism and make sure that we have newspapers and reporters that are holding power to account, using
Yeah.
AI to do that at scale. And I have to tell you, like
Mm.
my life, this work now takes us across continents and disciplines. I travel pretty much all of the time because we made a commitment that we'll be where communities are instead of asking them to come to us. We spend a lot of
Yeah.
time learning about the vulnerabilities and the ways that people are afraid of AI. That's a necessary thing that we have to do, but
Yeah.
also making sure we balance that conversation with the opportunities, the promise of what these AI tools could mean if they weren't just built for us to be consumers of them, but built because they empower us to do great things in the world.
What are some examples of how you think AI is improving healthcare globally? So it could be, domestically or internationally, whatever.
We have an exceptional team at the foundation. One of the things we've really invested in is a question of how do we ensure that we take all the things that we know, the data that reflects people's health journeys, and equip governments and caregivers to make better decisions at population scale. I'll give you one example. We work with an incredible organization that's working in a very, very undeveloped part of the world, in rural India. And for 25 years, they've been supporting these communities and making sure that young mothers or expecting mothers have really high quality access to care. To ground us and cite us appropriately, these are the places where there's no
Yeah.
hospital, there's no
Yeah.
super fancy delivery room. It's often a village where there's somebody who comes in and provides community health support on a traveling basis. Okay, 25 years of doing this work. I mean, this is really the work that saves lives. But they
Yeah.
also have collected a massive amount of data about health outcomes and about access. And using AI in a longer story that I'm happy to tell you another time, they figured out how to do something really powerful. They look at a map of this entire region, and using AI, they're able to identify particular communities that consistently aren't getting the best care. They ask, what are the things that are driving the health outcomes that these folks are getting? And one of the things they were able to identify was there's a nutritional deficiency that keeps popping up in a couple of villages because of local practices. Within 6 months of this realization, they worked with the government to ship in nutritional supplements, and they
Mm.
fundamentally changed the outcomes for hundreds or even thousands of young children. Okay, that's
Yeah.
one example. Let's bring
Mhm.
that back to the bigger picture. There's so much that happens in a system that we all know is really frustrating. It's
Yeah.
inefficient. It means that people don't get good local care. If we could bring AI tools to bear on that aren't just about maximizing profits for health
Yeah.
institutions, but instead are about really good, high quality outcomes for people, we're really excited about the possibility that we could restructure the way that people around the world get fundamental access to life-saving care. I really do believe that we are in a time where everything that we kind of know about the world we've created is being tested. Some assumptions about our economic, our political, our social structures, about what technology will mean. It's not a story about AI, it's a story about the society we want to build. And in that moment, the uncomfortable truth is a lot of what we relied on and gotten comfortable in is going to change. But the
Mhm.
response to it is we have this incredible power to change it ourselves.
Yeah.
And so we have a responsibility and an opportunity tied together to ask the question, what's the world look like today? And what do we wish it looks like tomorrow? And what are we going to do to create that together? I think that's an incredible time to be alive.